Hello, my name is Mary Campbell, and today I'm going to be presenting dissociative identity disorder. Before I discuss the disorder itself, I would like to mention a few variations in the DSMs throughout the years. In the first edition of the DSM in 1952, this disorder was referred to as a psychoneurotic one, unlike today when we know it as a dissociative one. The DSM-2 in 1968, it was put under the classification of neuroses and was called hysterical neurosis dissociative type. The DSM-3 in 1980, the class of dissociative disorders was added to the DSM, and the name was changed to multiple personality disorder. This is probably what you'll hear it called by the most, but this is not the most accurate or technical term anymore. It was in the DSM-4 in 1994 when it got its current name of dissociative identity disorder. In the DSM-5, this disorder is defined as a disruption of identity characterized by two or more distinct personality states. And the Gale Encyclopedia of Mental Health lists symptoms such as noticeable discontinuity of sense of control, no sense of self, changes in affect, perception, cognition, and behavior, and gaps in memory. Prevalence for this disorder is 1.5% of U.S. population in 12 months or 1 year, and for males it's 1.6%, and females it's 1.4%. But the female-to-male ratio of diagnosed cases is 9-to-1, and this is believed to be caused by the fact that men are more likely to avoid the therapist, deny symptoms, get incarcerated, and admit to their traumatic history, rather than hold it in. Causes of this disorder include severe physical or sexual abuse during childhood, no comforting family or friends to counteract that abuse, influence of relatives with dissociative identity disorder, and just the inability to dissociate. A lot of times when people have dissociative identity disorder, therapists find that they have either dissociative amnesia or dissociative fugue as well. And sometimes they even have them both with the dissociative identity disorder. Some treatments for this disorder include psychotherapy. This is one of the most common therapies for this disorder. It has 3 stages to it, and the goal of it is to integrate all personalities into one core identity. The first stage includes focusing on the therapist getting to meet and understand each personality, and this is important because each personality is a fragmentation of the patient's core identity. And while the therapist interacts with each identity, they can also get insight on traumatic events that caused this person to develop the disorder in the first place. And in order for the patient to successfully integrate all their personalities into one, all traumatic events and purposes of each of their personalities have to be acknowledged and accepted by them. The second stage, fusing, is the stage where the therapists take info learned and use it to help integrate the alter's values into the core identity. And it also helps the patient learn how to interact socially with people and how to make sure that their identities stay under their control. The consolidating stage is just a strengthening stage. It's where it is just back-to-back practice of socially interacting and keeping control of themselves and not switching our identities. This therapy can take 5 to 7 years to even show any signs of improvement, but it can also be used alongside other methods and treatments. Second kind of therapy is dialectical behavior therapy, which is a form of cognitive behavioral therapy. It practices mindfulness or the watching of thoughts go by. This one focuses more on like the thoughts of its other personalities. They just kind of ignore them. They acknowledge that they're there, but they ignore them. And they also teach them soothing techniques. This is for when they are out in a social setting and something may trigger them to want to switch. It teaches them how to soothe themselves down and stay in control. And it also teaches them coping skills for lapses in memory for when those slip-ups do happen and maybe they do switch personalities. But this therapy focuses more on the peaceful coexistence of the personalities with the core identity rather than the integration of all personalities into one identity. Some people with this disorder believe that psychotherapy is trying to kill or get rid of their personalities, and it really freaks them out. So it might be a better idea for them to do dialectical behavior therapy, because they still keep all their personalities, but they learn how to control them. Some medications for this include antidepressants or tranquilizers, but most therapists don't like to prescribe these because almost everybody with this dissociative identity disorder has at least one personality that has addiction. And so it's not a very good idea to give them these, because obviously it can just worsen their addiction. And so in order for them to help these people without prescribing them antidepressants or tranquilizers, some will prescribe botanical herbs to help anxiety. Some history of this disorder started way back in 1584. This is when the first case of dissociative identity disorder was thought to have been discovered, but at the time it was referred to as possession. The woman had every symptom of dissociative identity disorder, but nobody knew what that was, obviously, at that time. So they considered her as possessed, but she would act as different people randomly, and she would forget where she was going. She wouldn't know who she was sometimes. It was every symptom that she could possibly have for this disorder, she had it. But since it was so long ago, not much research can prove that that's exactly what she had. But it's pretty likely that's what it was. In 1791, this is when the first well-known case was documented, and it wasn't considered possession. She was considered the French woman or the German woman, but she was actually a German woman, and when she would switch personalities, she could speak perfect French, and she acted as a French aristocrat. And when she was the French woman, she remembered everything she did. But when she was the German woman, she had no idea about her other personality. It was in 1880 through 1920 that studies were actually starting to be conducted, and many were. And lots of information was found during this time. But it was in 1944 that other studies found that 67% of all dissociative identity disorder cases were found during the previous time frame of 1880 to 1920. This kind of makes therapists a little nervous, because there's always been a dramatic rise and fall of this disorder throughout history, and they think it could be because of misdiagnosis or the thought that it might be iatrogenic, because people will endorse the symptoms if they believe that that's what they have. They see popular cases in the newspapers and things like that, and they think, I have that, and they endorse the symptoms. And that's just one controversy. It's not proven, but it's a thought. In the 1970s, the release of Sybil, the book, and then eventually a movie, but it caused dramatic increase in cases of dissociative identity disorder in the 70s. And it's funny because this actually turned out to be a fake case, but it completely increased the number of cases, which also might prove the iatrogenic theory. Some statistics. I just wanted to show a chart of the dramatic increase and decrease throughout the years. Dissociative identity disorder is the red line on the bottom, and you can see that it just jumps and falls randomly, and researchers still aren't sure why. They have ideas, and I just discussed them. It could be because misdiagnosis, overdiagnosis, or it could be because people are just endorsing symptoms because they believe that's what is wrong with them. This disorder is very costly. The National Library of Medicine says that it can cost $300 to $800 a day for inpatient care. And that is obviously a lot of money, especially if they don't have insurance. And so, most people without insurance that have this disorder go without care, because even if they did an outpatient care center, it would be $100 a week, and that's still a lot on a weekly basis for somebody with dissociative identity disorder to come up with. It was shown in 2013 that 2.6% of the Medicaid inpatient costs, I'm sorry, I said that wrong. 2.6% of the population that took out for Medicaid had dissociative identity disorder, and they made up a 33.5% of Medicaid inpatient costs. That's a lot of money, and that's not even including all the other things that they paid for. Some controversies with this. The idea that dissociative identity disorder is a fragmentation of one identity and not separate identities led some researchers to think, how much control can a person lose? Because if it is a fragmentation of their identity, then it would still consider their morals. If they say, oh, well, I didn't know what I did. Well, if that's part of you, then how would that part of you not respect your values? And so some people think that it's kind of iffy about it, just thinking, well, you can't say that you lost control if that's who you are. Hypnosis was a very controversial thing with this, because some therapists would use it to uncover the traumatic events that these people were hiding, because obviously it has caused them to have this disorder. So they are burying that very deep. So instead of taking the time to talk to them and figure it out themselves, they would just use hypnosis. And it was actually very helpful, and it sped up the process, but it's controversial because they think that it can actually cause people to get dissociative identity disorder by making them so suggestible that they open up about things that their brain doesn't even want to think about. And iatrogenic, I've already discussed this a little bit. Some researchers think that this is an iatrogenic disorder, because obviously the rise and fall throughout the years has happened right around the time that this disorder was a big debate. And here are my citations, and thank you so much for listening.